Team in Thailand are now being treated by doctors at a hospital.
Joining us right now to talk about the challenges still in taking care of these kids, Dr. Richard Chaffoo is back. Doctor, good morning.
Good morning,
just
Raoul.
a miraculous story all around.
It is. Wonderful story. Wonderful
they're all
ending.
out of the Cape, but
Yes.
now people talking about the cave disease and possible infections, this and that. What are the challenges facing the kids now?
Well, the challenges are just what you said, Raoul. You know, there are diseases that are particular to caves. There are something actually called spleniosis or cave dwellers disease, which is actually a fungal infection. As histoplasmosis is the organism. It actually grows in the soil all over the world, and especially in caves where there's bat droppings or bird droppings, it feeds us. And the problem is that when these kids are in these confined environments and they're kicking up the dust, they can inhale the spores, which really you can't see with the naked eye, and they can get infections. Histoplasmosis, of course, getting into the lungs can cause potentially serious infection.
I want to talk a little bit more about this cave disease in a moment, but I know that we've been talking all week that the soccer players who were rescued have been in quarantine and like their parents did not even see them. So what is the first thing that doctors need to do right now as they are starting to give attention to them?
So you treat people that come out of an environment like that as trauma victims, if you will. So when they present to an emergency room, obviously the vital signs you want to check, because a lot, they may be hypoxic, they may have high levels of CO2 from rebreathing this air, oftentimes hypothermia, malnutrition. All of this, Shally, really depresses the immune system, and so makes these kids much more vulnerable for serious illnesses that we might find very minor, for instance, the flu. And someone, a family member, a friend, could bring this into these kids at this point. So the most important thing right now is quarantining them, doing testing to make sure they don't have cave dwellers disease, another disease called leptosporiosis, which is a bacterial infection, potentially fatal. They can get in that environment. We want to make sure that they're well hydrated, their vital signs are stable, there is no evidence of any serious illness, and it just takes time for the doctors to work through this process.
You mentioned the quarantine, you mentioned the testing, because I wanted to ask you how any of these diseases, potential diseases, can be detected. And I'm talking the amount of testing that's being done on these children, it must be just off the charts in terms of they're looking for anything and everything, right?
They are looking, exactly, Raoul, and this can take time for some of these results to come back and get the results of these tests. Meanwhile, some of these infections very early on are completely asymptomatic, so we want to make sure that these diseases are caught early and treated early.
Yeah, so you talk about the symptoms. You're saying some you won't have any at all. Others, what would be some of the symptoms that they're looking for?
So the symptoms would be flu-like symptoms, Shally, where like they have a cough, a fever, a headache, myalgias. They may have diarrhea, vomiting, redness to the eyes, especially in a disease called leptosporiosis. So they can have obviously no symptoms at all, or they can be very mild symptoms where you think of a flu-like illness like a virus, but the problem is these are kids that may have a compromised immune system, and this which would affect us may be asymptomatic, could develop into some serious complications.
Long-term effects is what I wanted to know about, because if it's something that doesn't show right away, this is something that they're going to have to follow for months, if not years, in terms of see if anything comes up, right?
Exactly.
My goodness. Contagious? I mean, are they contagious, or can they be more, obviously, because of the immune issues?
It's fortunately, Raoul, these are not contagious disease. They can't be passed from person to person, but all of these kids were in the same enclosed environment for quite a long period of time. There could be, more than one of these kids could be infected with these diseases.
It's miraculous.
It is miraculous.
I mean, it's all around. Considering the alternative of what could have happened, this isn't exactly the, I mean, you'll take a couple of quarantine days and a week.
And they're otherwise healthy, they're in good, they're soccer players, so all that portends to a really good prognosis.
Just an unbelievable story. Doctor, we thank you as always for your expertise.
All right, 8:34, let's get you over to Chrissy Russo for